Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Burns, we are looking at the formulae of the fluid calculation as per the ATLS, the 10th edition, 2018. So the first one is we need to know about the Parkes formulae. So there is something known as the Parkland's formulae. Parkland formulae. So what this does is it gives a total fluid requirement for 24 hours. So it gives a total fluid requirement for 24 hours. And half of its volume is infused in the first 8 hours. So half is infused in the first 8 hours. And next the remaining half, the other half, is infused in the next 16 hours. So the formula is recommended for those who have sustained large deep. So it is recommended for the large deep partial thickness. So large deep partial thickness or full thickness burns or the full thickness burns. So this covers about 20%. So this will be covering about 20% of the TBSA. So TBSA stands for the total body surface area, and this is in terms of the adults and more than 10% in terms of children. The formula provides a starting target rate. So it provides a starting target rate, and subsequently the amount of fluid provided should be adjusted based on the urine output. So the amount of fluid should be adjusted based on the urine output. Now let's compare the category of burns with that of the target urine as well as the amount of ringer lactate. So first, the category of burns, it can be second or the third degree burns. So here in second or third degree burns, look at the age. So age can be, first is the adults. So adults, the amount of ringer lactate in the first 24 hours. So we look at RL, that is given for the 24 hours. So in terms of adults, there is the formula is 2 into weight in kgs. So 2 into weight in kgs, and this multiplied by the percent of the TBSA. So now let's look at the target of the urine output. The target of the urine output. So the output will be in ml per kg per hour. So what is the output here? It is going to be 0.5. Now moving on, we saw the adult group. Now moving on to the age group less than 14 years. So less than 14 years, there is the formula is 3 into weight in kgs into the TBSA. So this multiplied by 1. Next is the age, that is less than 1 year or less than 30 kgs. So in such cases, we have 3 into the weight in kgs into the TBSA, and along with this, it is 5% of dextrose on a maintenance rate. So you do 5% dextrose, and this is on the maintenance rate. So the target urine is here, it is nothing but 1. So it is ml per kg per hour. Then we move on to the 4th degree burns. So as per the 4th degree burns, it is nothing but the electrical burns. So here what are the ages? It is seen in all ages, and the formula here, the ringer lactate given in 24 hours is going to be 4 into the weight in kgs into the TBSA. So as we go to the 4th, it is into 4. Now what is the target urine? That is the ml per kg per hour. It is going to be 1 to 1.5, and this is basically until the urine clears. Now let's look at the dextrose maintenance. So in terms of the dextrose being maintained, the dextrose maintenance, so this is going to be 100 ml. So 100 ml per kg, and this is in 24 hours for 10 kgs. Next is 50 ml per kg, and this is for the next 10 kgs. Then we have 20 ml per kg, and this is for every kg after 20 kgs. This is for every kg after 20 kgs. Now let's focus on the Evans formula. So Evans formula is used for the NS. NS means the normal saline. So for the first 24 hours, let's look at the scenario. So the first 24 hours, the amount of NS administered. So what is the amount of NS which is administered? So amount of NS administered is nothing but the weight in kgs. So it is the weight in kgs into the TBSA. So what is the amount of colloid administered? So amount of colloid. So amount of colloid administered is nothing but the weight in kgs. This is weight in kgs into the TBSA. And lastly, the 5% dextrose, it is administered. This is about 2000 ml. So after 24 hours, the amount of NS and the colloid administered is half. So after 24 hours, the amount of NS, so the amount of the NS and also the colloid. So the amount of NS and the colloid which is administered is half. This is half, and there is about 2000 ml. So there is about 2000 ml of dextrose. So 2000 ml of the dextrose, this is maintained. Next, let's look at the Muir and Barclay formula of colloids. So Muir and the Barclay formulae of colloids. So as per this, 1% of the colloid, so 1 portion of the colloid, this is equal to the weight in kgs. This is the weight in kgs into the percent of the TBSA, and this will be divided by 2. The next is the 6th portion. So there are 6 portions, and this is of the colloid. So there are 6 portions of the colloid. They are administered over 36 hours. So they are administered over 36 hours. To learn and grow daily like this, please do subscribe.